Breastfeeding problems. Breastfeeding is nature's way of making sure your baby gets all the nutrition he or she needs. Experts recommend feeding your baby breast milk exclusively for at least the first 6 months of life, longer if you can, but that can be a challenge for some women. Understanding some of the common problems and solutions for breastfeeding will help you successfully breastfeed your baby. Here are some common reasons why breastfeeding may be frustrating, scary, or difficult for you. Your baby is premature. Your nipples are sore. You have a breast infection. You may not make enough milk. You may make too much milk. Your baby might stop breastfeeding suddenly. Your nipple or breast shape might make breastfeeding harder. Or you may have trouble breastfeeding when you return to work. Overcoming breastfeeding challenges. The best way to overcome breastfeeding challenges is to get support and education before you have your baby. Consider taking a breastfeeding class. Tell your partner, healthcare provider, family, and friends about your plans for breastfeeding. Although breastfeeding can be challenging, especially at first, most women can successfully breastfeed. Ask for help from a lactation consultant when you're in the hospital or at home. Lactation consultants are breastfeeding specialists. They can help you avoid many common problems and breastfeed correctly right from the start. You can do many things to help make breastfeeding easier. For example, when your baby latches onto your breast, make sure your nipple and most of your areola go all the way into your baby's mouth. Try to readjust your position or your baby's position to find what works. If your baby doesn't latch correctly, gently break the suction with a clean finger and help your baby latch again. Breast milk helps your skin heal. When your baby finishes feeding, gently rub some of the breast milk onto your nipples to help them heal and prevent soreness. Wear comfortable clothes that give you easy access to your breasts. This will make it easier to breastfeed in public. Your supply of milk will usually adjust to match your baby's needs. As your baby grows and needs more milk, he or she will want to feed more often. As you feed your baby more frequently, your body will know to make more milk. Watch for signs from your baby that he or she is hungry, such as making a sucking sound or putting a hand in his or her mouth. Feed your baby when you see these signs. Don't wait until your baby is really hungry to feed him or her. It's also important to keep your breasts clean and dry. If you use breast pads, change them often. Make sure to check with your healthcare provider before you use any oils, creams, or medications on your breasts. Things to remember. Almost all women can successfully breastfeed. The most important way to overcome breastfeeding challenges is by seeking support and education before you have your baby. A lactation specialist can help you overcome any breastfeeding problems you might have. What we have learned. The most important way to overcome breastfeeding challenges is by seeking support and education before you have your baby. True or false? The answer is true. Breastfeeding classes and lactation specialists can teach you ways to overcome breastfeeding difficulties. When your baby latches onto your breast, make sure only the nipple goes all the way into your baby's mouth. True or false? The answer is false. A proper latch-on is when your baby takes all of your nipple and most of your areola into his or her mouth.